disorder. There's nothing to hide there. The patient name is there. He has a registration number. My history assessment, I take subjective data, which include abdominal pain that started 5 days ago, abdominal burning, heartburn, severe malaria. So, history of the presenting illness, the patient physically looked all right. That is 3 months back. Then it developed malaria. Pain in abdomen since 5 days, and he has constipation. And the past medical history, he has no allergies before and no childhood illnesses. All required immunization has been done. So the patient was hospitalized at first because of this case, but no surgery done. So there was no transfusion of blood and all these things. Family history, he has a nuclear family, according to what he said, but none of his family members has this disease. And social history, because of pain, he has this disturbed sleeping pattern and he's smoking, by the way. In environmental history, he's a soldier. According to the patient's profile, he's a soldier. And the psychological history, we know these soldiers always, they do stay, they do go without food sometimes and all these things. He's so stressful about his family. So he's so worried because no one is taking care of his family. And on physical examination, he has fair complexions, height, his height is 178 centimeters, 54 kilos, and the BMI is 17.04. Why did I have the BMI? I want to determine the weight loss rate, and all the vital signs are normal according to my examinations. Systemic examination, is the skin color is okay, no cyanosis, and there is no any disease process that is shown. On auscultation, there is nothing bad that is seen. Cardiovascularly, on palpitation, the chest was reported okay. And coming to my nursing assessment, since the pain was the first complaint from him, I have put my diagnosis this way. Acute pain related to chemical burn of the gastric mucosa as evidenced by abdominal burning sensations. Acute pain being the cause, chemical burn, acute pain related to chemical burn being the cause, and the peptic ulcer being the problem, and evidence, abdominal burning sensation being the symptoms. So my goal is to reduce the pain, and reducing the pain is by giving these people therapy, omeprazole, metro, to kill the anaerobic bacteria that is present, and amoxicillin also to kill because they are. I want to identify if the problem is caused by anaerobic, that is the reason of giving metro. And then, because the pain or the cause might be because of aerobic bacteria, that's the reason of giving amoxicillin to kill. So implementation is there. Implementation is there. I reported the pain, not the report down and where the pain is located. And he was having a heartburn and abdominal pain. So That was what I reported. And the regional, since the pain is not always present, but if present, should be compared with previous pain. So that is it. This comparison may assist in diagnosis of the cause of bleeding, and that is why he had malaria. The evaluation was that after doing all this, the goal was met. And patient has verbalized the relief of pain and demonstrate a relaxed body posture because I've given the triple therapy. So that is the subjective data. And my objective data this one is because he has maybe low knowledge on how to prevent this disease, and that is the reason why the thing is repeating itself. So my objective, nursing diagnosis, is deficient knowledge related to repetitive incidents of gastrointestinal bleeding secondary to peptic ulcer disease, as evidenced by reappearance of the symptoms. Reappearance of the symptoms. I will repeat, it is not there. Deficient knowledge related to repetitive incidents of gastrointestinal bleeding secondary to peptic ulcer disease, as evidenced by the appearance of the symptoms. That includes malaria, disease. So I have graphed the medical management report. So here it is classified into medical care plan is classified into three, where we have the immediate, the intermediate, and the long term. So because that patient was having a bleeding and a vomiting, the immediate treatment I go with metro at first to kill, and then give the fluid. And maybe these things are not shown here. I prescribed the metoclopramide because he was vomiting, and then intermediate treatment it was given before. Here we do triple therapy. Long term is histamine blockers or antagonists that we prescribe. So there is surgical being done, but because our level of healthcare settings, we were doing our practicals in the PhDs and do referral. Health education here is to stress the importance and advantages of compliance with the medication, because that patient was not advised before on how to avoid the occurrence of this peptic ulcer disease. Then discuss the patient his understanding of the condition, how he understood the condition. I also encourage the patient to have good personal hygiene, and that's one of the important measures. And then advise patients to develop the discharge instructions given by the doctor. Finally, I document. That is the end of my presentation. I know there are a lot of
Okay, thank you, William. But not William Deng.
Mapac. Mapac, yes.
Why are you so suspicious? You have to put in your mind that what you have presented is what you have brought for us is correct. Don't be suspicious that I have gained some information but some are missing. This is the wrong idea, okay? You have to put yourself that what you have presented is good, is correct.
Yeah, the layout or the format given is restrictive, so I put more information there.
Okay, good. You have presented it well, and this is topic or case presentation about peptic ulcer disease. From the beginning, define for us very well. What I'm going to ask from you, you say for us there is pharmacological management and non-pharmacological management. That means two we have management.
Yes.
Pharmacological and non-pharmacological. And as you say, in non-pharmacological management, you are just giving a counseling. Is it counseling?
Triple therapy.
Counseling, non-pharmacological.
Oh, yeah.
You say counseling.
Yes.
Okay. What advice are you really going to give to this kind of person? Or which kind of education or which are the counseling that we are, points of counseling that we are going to give to this kind of person who is having peptic ulcer? And from the beginning you have indicated for us this is juvenile